My name is Karen Warren. I'm a student of Bates Technical College LPN program, and I'm gonna perform a hand sterile gloves and sterile wound dressing. And I'm gathering all the necessary. I'm performing my LPN now. I have all the necessary equipment that I'm using for this skill, and I have my protocol to follow. And I disinfected the area that I'm using the same way as this one because it's for sterile gloving. And I'm gonna apply hand hygiene. And I'm gonna dry it. And now I'm gonna perform a welcome for Pearl patient job. I'm gonna close the window for privacy. And I'm gonna put a hand hygiene again because I forgot to put gloves on. So now it's dry, and I'm gonna apply gloves. Good morning, Miss Pearl. Jam. I'm gonna check your identity in your wristband, and I'm gonna check if you have some allergies. Are you comfortable?
Yes.
Thank you. Okay. I'm gonna touch you and I'm gonna check your wrist, okay? For identification. Jam Pearl?
Yes.
916 XX?
Yes.
And you have an allergy of ink, iodine, shellfish, and latex?
Yes.
Good. Is that all allergies?
Yeah.
Okay. Miss Pearl, are you comfortable?
Yeah, pretty comfortable.
Okay, I'm gonna perform a sterile wound dressing on you. So I'm gonna open your blanket right here, but I'm gonna keep it this way for your modesty. Just enough. I am gonna check if you have a padding in here, so that you don't get wet. Yes, it's here. Okay. So you need a dressing. Your wound needs dressing. So are you okay with that?
Yes.
Is the medication for pain?
I do need a little medication if you're going to do that.
We should wait a little bit and it should kick in a bit.
Okay.
Okay. What about now? Is it okay?
I'm feeling pretty good.
That's good. So we can start the checking and dressing your wound. Okay. So I'm gonna open your wound. And I'm gonna use my hand against your skin. I'm trying to make it slow so that you wouldn't be uncomfortable, okay?
Okay, thank you.
You're welcome. Okay. So now I am gonna pick up that glass inside of you, okay?
Okay. I wonder how it's going to look.
It's pink, it's soft, it's red, and there's no pus.
Oh,
So
good.
the same way as the glass inside, it's red. There's no pus on it.
Okay, thank you.
You're welcome. Okay, Miss Pearl, I am gonna disinfect again. I'm gonna put another glove for 15 seconds so that it will dry. I'm gonna measure the diameter of your wound, how deep it is. Also,
Okay, that'll be interesting.
yeah, I know. I'm gonna check for tunneling also. And if the wound is firm and the color, I'm gonna assess it.
Sounds great.
My hands are dry. So after I put the hands, while I'm doing this one, before I forget, I'm gonna do the tape, okay?
All right.
Maybe, I mean, like they
Are
didn't
you
have,
still
like, make it
comfortable,
any-
Miss Pearl?
Yep. Still
Good.
comfy.
You okay?
Did she fail her diploma? Oh, that's fine. Not a big deal.
Well, she never successfully completed that test. And
No, yeah, that's why it's not a big
they
deal.
never made her do it before, so that's why I was like,
Oh,
oh.
that's weird that they were.
But
Maybe they did an A1C before.
I just figured that's all it was. But it was like, no, but,
We'll see.
What are your initials? Okay. Okay, Miss Pearl. I'm gonna write down. I'm gonna write down the my initial, the date, and the time. Can I borrow? Andrea, can you hand me a pen, please? So I'm gonna write down my initial, date, and time. Thank you. So since I touch everything, I'm just gonna take off my gloves and put another one. I'm gonna put sterilizing again, and I'm gonna dry it in 15 seconds. And I'm gonna put in new gloves.
Just a sec. Yes.
So Miss Pearl,
Yes.
I'm gonna assess the wound now.
What's my name?
Okay, Miss Pearl,
Oh.
I will open the cotton stick with cotton buds on tip on it. Butterfly.
Okay, do you mind if I?
It's not sterile yet. So here's how I'm gonna do, Miss Pearl. I'm just checking, okay? For tunneling, debris. Okay. I'm gonna throw the stick, and I'm gonna get another stick to measure the deepness and the width and the length of the wound. So I'm gonna start on how deep it is. I'm gonna go to the deepest part, and I'm gonna put it by the skin, and I'm gonna measure it.
Any questions?
3 inches. And now I'm gonna measure it across.
All right. It's so fun to do though.
2 centimeters, not inches. I'm gonna repeat what I said, the deepness, because I said inches. I'm gonna repeat it just for it's 3 centimeters, not inches. Corrected. And then I'm gonna start again on the wide, how the width. 2 centimeters. And then the length of the
Yes.
9 centimeters. So I'm gonna document it that the wound deepness, width, and length is 3 centimeters deep, 2 centimeters width, and 9 centimeters length. So now I'm gonna take off my gloves again.
I literally like finished my task and got ready.
And I'm gonna disinfect again, and this is the start of the sterile gloving. And I have to be careful not to go underneath the clean surface. It has to be up in my waist. Below that is unsterile anymore.
Everybody's good.
So I'm gonna open and touch only the side.
We can talk about it more, but I think my problem is, like I said, I don't want to throw off.
Forgive me, I forgot again. I did disinfect the thing, but I have to wear gloves. Okay, I am gonna put this one as close as I can. It's called the dressing change tray. And I'm gonna open my solution. And I'm gonna open it and lip it. And remember that this is the clean side. Okay, and now I'm gonna butterfly open my dressing change tray. And be careful not to touch the inside of it to keep it sterile.
We had this whole issue when we were in CNA doing that class.
And roll it under
Almost gotcha.
and put it aside. And now I get everything that I need. So all I need to do now is
Pad.
huh?
The pad. The drape.
Does it actually hurt your
I will pick up the drape fast and put it in there and touch only the one that says by the line. And pull it away from the table. So now I'm just gonna touch the edge of it.
Oh my gosh, I'm so sorry.
And put it,
Initials are H3.
and that's my sterile film right there. So now I can take off my gloves and, oh no, not yet. No, I can't. I still have to dump. I have to dump my sterile dressing into the sterile film fast. And touch only the side. And I can throw this one in the garbage.
Nope. You need to put it back. Fluid.
Oh, excuse me, I cannot throw it and haven't touched anything yet. I will put it back because I will have to use this one for my solution. And it's still sterile. Okay. And now I'm gonna pour
It'll disappear after a while.
my solution.
Yeah. I was like, mine, like, I need to get like an actual wash.
And now I can throw the bottle of the solution. And now I'm ready to apply my sterile glove.
There's no way.
First, I'm gonna throw my unsterile gloves and disinfect my hands. So 15
I was like, no, like, mine's like
seconds
annoying where I keep like
and it's dry.
doing that for it to keep doing it.
So now, I am gonna, while I'm doing this one, I'm just gonna move everything away. Okay. So I am gonna open my sterile gloves, open it butterfly. And here's my sterile gloves, and I'm gonna open butterfly. And then I'm gonna put this one in the garbage. Okay? So I am gonna open my sterile gloves. First is I'm gonna open the lip on it. The one farthest away from me.
If you want to. I always do the whole minute just in case. Yeah. But I know in the book it says you can. Yeah.
And then I'm gonna open the lip close to me.
Yeah. Because in the book it says you can do it for 30 seconds. And then multiply that. I always just do 1 minute.
And I have to be careful not to turn away from my sterile
Because I don't know if they're numbered.
field and my sterile
I just want your vein blood pressure and work
gases
and do that.
and wound dressing. And keep my hands
Yeah.
up, not below my waist. So now I'm gonna open the sterile glove package this way. Okay, so I'm gonna glove my dominant hand first, and I'm gonna pick the cuff here away from the table.
How are you?
And it don't look good yet, but next I'm gonna pick up the glove on the cuff from the inside because my hand is sterile already, and I'm gonna put it in my other hand. And then I'm gonna put it in my hands. And then I'm gonna fix it, sterile to sterile. And then now, sterile to sterile, I can fix it. Oh, I suppose not to do the bouncing thing.
Snap.
Don't snap it for vibrations. So now I got my sterile gloves and I can pick up anything and arrange everything in my table in the sterile field, but not to go over them to keep it sterile. Everything in the edges and this way are I'm putting my hands over here so that I don't touch anything to keep it sterile. So now I'm gonna arrange it. Andrea, can you get me 2 gauze and put it in my solution, please?
Yes.
It's right there at the table.
Is that your
2.
your gauze right there?
Oh, okay, I got this one. Okay, I'm gonna
Yeah.
pick it up and put it in my solution. Okay. So now I'm gonna clean pearl jams wound with pocket cemented swab stick. Okay, I'm gonna do the one farthest because it's the most cleanest. I'm gonna start from here, there, throw. And I'm gonna do the one close to me, throw. And then I'm gonna do the dirtiest part, which is the middle. Okay, and now I'm gonna pick up the gas to put it on. I'm gonna dry the wound first. And now it's dry, so I'm gonna apply the solution with the 2x2 gauze on it.
I'm Jeannie. We got Jeannie and Jenny. I'm Jenny. I know Jenny.
So I'm gonna apply it into the wound. So now the gauze is fully applied. I'm gonna throw the forceps into the garbage, hazardous material. So now I am gonna apply the gauze. This is my cleanest hand that is still sterile. So this is the one I'm gonna use. And now I'm gonna pick up the wound.
Got
And now the wound is covered. So now I can apply the tape. So now everything is sealed. So
You said your glove was dirty?
yes, my gloves is dirty, so I'm gonna get rid of it. So I'm gonna disinfect my hands for 15 seconds, and now it's dry.
Was it good?
Okay, and now I can fold this one, the cloth, and I will apply the tape with the date, initial, and time. Okay, and I'm gonna clean everything and disinfect everything.
Fix this gown.
And I will close the close the clothes and put back the blanket and ask Miss Pearl, are you comfortable?
Yes, thank you.
Okay. Okay, and now I can clean.
Remember not to touch the inside of the bag.
Okay. Remember not to touch the inside of the bed. And now I'm gonna close my bag, the hazardous bag, and I'm gonna get rid of it. I'm gonna tie it down properly. And I'm gonna throw it on the proper hazardous material garbage can. Okay? And I can get rid of my other gloves. And I'm gonna disinfect everything that I used. And I'm applying a sanitizer. I'm gonna put the gloves on. So I'm cleaning everything. throw everything, and I'm gonna perform my end skills. Miss Pearl, here's your call light. I'm gonna open your window, your curtain window, and are you comfortable?
Yes, thank you so much.
And I am gonna document everything, the one that I just applied skills to you, which is documenting the redness of the wound, the tunneling. There was no tunneling of the wound. There was no pus in the wound. It was clean and it looked like alive and pink. And the length of the wound is 9 centimeters. The deepness of the wound is 3 centimeters, and the width is 2 centimeters. And I will document it.
If you need me, call.
And that's the end of my sterile care and sterile gloving.